The United States has surpassed 21,000 cases of monkeypox, which is the most out of any country. But the good news is that cases appear to be slowing as vaccines become more available. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, for an infectious disease update, we're getting answers from one of our top experts in the field about high versus low risk activities for contracting monkeypox, as well as what to expect this fall with the flu and COVID-19. With me today is Dr. Sarah Boyd, an infectious disease physician at St. Luke's Health System. Thanks so much for joining us.
Thanks for having me.
So, Dr. Boyd, first off, monkeypox spreads much differently than COVID and what we've been seeing the last couple of years. Can you explain how this viral disease spreads?
So it spreads predominantly by close skin-to-skin contact. You can see it spread through sexual activity. There's some risk with oral secretion, so kissing or prolonged skin-to-skin contact with someone that has an active skin lesion. You know, initially they were seeing cases in men who have sex with men. And we certainly know that that is a risk factor, but additionally it can spread for really anyone who meets those criteria of that close, prolonged skin-to-skin contact.
Okay, good to know. Now, keeping that in mind, what activities are high risk versus low risk in contracting monkeypox?
Certainly those higher risk activities are going to be that prolonged skin-to-skin contact. So sexual activity, kissing, cuddling for a long time. And then lower kind of moderate risk would be, you know, being in a large crowd where you're close to close contact with someone else, exposed skin. And then low risk would be, you know, just going out to the store, going to eat, meeting friends after work.
Okay. So when should a person get tested for monkeypox and how do you go about doing that?
So anyone that has an unexplained skin rash, perhaps accompanied by other symptoms such as fever, swollen lymph nodes, or feeling unwell, should really reach out to their healthcare provider to discuss if they need to be tested for monkeypox. The local health departments also can offer that guidance for testing.
Okay. Now, who's currently eligible for the monkeypox vaccine?
So eligibility for monkeypox vaccine kind of varies across the country. Cities that are having large outbreaks are doing vaccination for people that are at high risk with multiple sexual partners, or they can also do it as post-exposure prophylaxis. So if someone has a known exposure to someone with an active case of monkeypox, they can give that vaccine within 14 days, although the earlier the better. We encourage within 4 days to prevent spread.
Okay. Now shifting to the flu, health experts say this flu season could be a particularly bad flu season. What are we expecting to see?
So I do think in the last couple of years with COVID, with masking and social distancing and restriction of large gatherings, we saw that definitely lower our flu season and flu cases as well. As those things have changed, I think we will see more flu this season. Australia is a lot of times what we use that Southern Hemisphere information for how many cases we might see, and they've had a much more active flu season this year.
Okay. So what are the recommendations for who should get the flu vaccine?
So everyone who's 6 months or older is eligible for flu vaccine, and that is a vaccine that you need to get annually. So we'd encourage anyone that meets those criteria and to go ahead and get their flu vaccine this fall.
Okay. And when's the optimal time to do that?
So really we're at that right time, headed into kind of October and our traditional respiratory season is when we give that vaccine. And that way you've got full immunity built up, headed into the holidays and times that people travel more.
Now, lastly, moving on to COVID, the FDA and CDC recently approved an updated booster shot. Can you tell us how this one is different and who's eligible to get that?
So this one, this COVID vaccine is different in that it's a bivalent vaccine. So it has the original strain for the COVID vaccine, but they also have a formulated more specifically for Omicron, which is our main circulating variant now. People who should consider getting their booster are those that haven't had a booster shot in the last 2 months. And then additionally, if you're high risk, you certainly should get it. And then it's really anyone eligible for a booster at this point would be 18 and older for the Moderna vaccine or 12 and older for the Pfizer vaccine.
Okay. Well, is there anything else you'd like to add?
I would just encourage everybody as we head into respiratory season that if you have respiratory symptoms, you're having fever, new cough, runny nose, sinus symptoms, to go ahead and get tested, because it could be flu, it could be COVID, it could be something else, and really that's the best way to know.
Okay, great to keep in mind. Thank you so much for joining us.
Yeah, thanks for having me.
To learn more or to schedule a vaccine appointment, visit stlukeskc.org. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.